Well, with much of the country firmly locked in a third wave, there is renewed worry over the variants, particularly in younger people.
With increasing rates of infection, we are seeing a greater number of younger adults with COVID-19 being treated in hospital.
And along with that concern, the snap decision we heard about earlier in the program, with a big swath of Ontario shutting down in-class learning, only to resume in about 2 weeks' time. So let's bring in infectious diseases specialist Dr. Zain Chagla and infectious diseases pediatrician Dr. Fatima Kakar to help answer some of your questions about kids, schools, and vaccines. Hello to the both of you. Dr. Chagla, we've got lots to get through, so let's get right to it. Given the kind of crisis point that we're at, where hundreds of thousands of kids are being moved entirely to virtual learning, let's start with this timely question from John.
While I fully support prioritizing vaccinations for frontline workers and medical professionals and understand the mental health benefits to keeping children in school, I can't understand why teachers haven't yet been given a place in the vaccination queue.
Dr. Chagla, what do you think?
Yeah, I mean, I think it's a very good point. You know, there are areas of Ontario particularly that have really, really high burdens, and we're seeing schools being shut down in those areas. I think prioritizing teachers within those areas where we're seeing high burdens, where other frontline workers and essential workers are being vaccinated, only makes sense to vaccinate teachers, administrators, the people that clean schools, childcare operators, as part of that, as realizing that they live in the communities that are in high burden, that they're exposed to people and they can't work from home. And again, you know, the safety of continuing schools with everything ongoing really does rely on having a healthy workforce. Right?
Well, and just so I'm clear, this is an argument in your mind that extends not just to all kind of essential frontline workers, but to teachers in particular.
Yeah, I mean, teachers should be involved in the essential worker group as part of that rollout, as they are essential workers. They're people that can't work from home that do provide a service in the community where they can be exposed to COVID.
Speaking of vaccination, Dr. Kakar, can you take this next question? This is from Paul.
I'm wondering, are there any clinical studies for any of the vaccines for youth that have been released or are pending?
I'm a parent. This is a question that I have as well. What do you think?
So some good news on that front. Last week, Pfizer had their press release. So they released their data on their 12 to 15-year-olds, and it looks like the vaccine works great. There were no cases in their vaccine group. So they're actually submitting for emergency use authorization, and potentially the Pfizer one will be approved as early as this summer, if not the fall. Moderna has also finished their enrollment for the 12 to 15-year-olds. So that age group potentially will have their vaccines approved by fall. Unfortunately, for the younger children, it's going to be a little bit longer because those studies are still underway, and they actually have to do what they call dose escalation studies. So we need to find the right dose. So we're still in phase 1-2 for the 6 months to 11-year-olds. So good news for the older kids. For the younger kids, it's still going to be a while.
Right. So months away at a minimum. Dr. Chagla, with vaccination still more of this kind of medium to long-term solution, we have gotten a lot of questions about masking. So in British Columbia, for example, they're talking about mandatory masking for grades 4 and up. But the question we commonly get is, what about even younger kids? So should grade 1s, even kindergartners, be masking more consistently?
Yeah, I mean, I think especially as things transmit, masking is, an important fail-safe in school. It helps prevent transmission, recognizing that kids over the age of 3 or 4 are able to mask consistently. I would, caution though, around the kindergarten age group, the cognitive abilities of kids and their ability to actually keep it on for a prolonged amount of time, pulling it off, shouldn't necessarily discriminate them about staying in the classroom. But I think certainly after grade 1, it could be an expectation, and it's been working in Ontario. We've been able to do that aggressively and haven't seen any deleterious side effects from it.
And with what we know about transmission in kids, you're saying that the benefits of masking, even for someone as young as grade 1 or grade 2, outweighs the pain involved in making it stick.
Yeah, I mean, it's not going to be perfect in that age group, but it probably does provide some help. And recognizing that we're putting kids in confined classrooms, the ventilation may not be adequate. You probably want as many barriers as you can for them to prevent transmission from person to person.
Dr. Kakar, what does the latest evidence suggest about how vulnerable children actually are, especially with the variants that are circulating?
So one thing that's super important to realize is that when we talk about younger people getting it more, they're getting it more, but they're not sicker. So younger children, so under the age of 19, yes, there are increasing cases in schools, and so there are increasing numbers overall, but they're not sicker from the new variant. So across our hospitals here in Canada, we're not seeing a surge in pediatric patients. And it's exactly what they saw in the UK. So even if we have these variants circulating, they're not sicker from it.
But let me pick up on something you just said, Dr. Kakar. Is it that we do believe schools can be a significant driver of transmission? Because I thought the early narrative was that schools weren't a place that we had to be overly preoccupied with.
So I think two things changed. So that first wave, kids were home. So we weren't seeing, we weren't seeing high rates of transmission, but now kids are in school. We had winter where there was way less ventilation, and we have the variants that are in school, and the variants are clearly more transmissible. So kids can transmit, they can get the infection, they can transmit the infection. And with these new variants, the issue is that they're more transmissible. So we put everything together in these last winter months, and that's where we've seen this increasing number in schools.
Okay, we have time for one more question, Dr. Chagla. Maybe I'll have this one for you. It's a very forward-looking question, maybe a little bit of a scary one. This is from Nathan.
Now that we're vaccinating more and more elderly people and older adults, is there a risk that the virus that causes COVID-19 could mutate to become more dangerous for younger adults or even children?
So that's kind of interesting. Is that a viable possibility?
Yeah, I mean, there's been a lot of discussion around these variants and mutations, and I think, you have to put it into context. We have had hundreds of millions of people infected in this world, and really in the context of a year and 3 months of transmission, we have seen 3 major mutations emerge that have been, part of what we talk about on a day-to-day basis. As you vaccinate more people, that pool is getting smaller and smaller and smaller. And every one of these mutations is a random probability. If you have less and less and less populations, the probability of that mutation happening starts shrinking and shrinking and shrinking every day. And so, again, a mass vaccine effort will likely work to reduce the number of variants and mutations, because that circulating pool, that chance of having the mutant emerge in the pool starts getting smaller and smaller and smaller as less and less individuals are susceptible to infection.
Okay, Dr. Zain Chagla is an infectious diseases specialist, and Dr. Fatima Kakar is an infectious diseases pediatrician. Thank you, both of you, for your time.
Thank you.